My name is Ashok Menon. I'm a consultant upper GI and general surgeon. My NHS practice is at the Stepping Hill Hospital in Stockport, and I have a private practice at both the Alexandra Hospital in Cheadle and the Spire Regency Hospital in Macclesfield. I think I've always wanted to be a doctor since I was a child. I have a lot of relatives that are in the profession, and one of my dad's elder sisters in particular, who was a gynecologist in Greater Manchester for many years, was a very big inspiration to me. But as I grew older, I became much more interested in life sciences, and I think it seemed like a natural thing to do. And I applied to medicine to Cambridge University. I was successful in getting there. I enjoyed it very much. I've always been interested in surgery from medical school, but I wasn't entirely sure about which area of surgery I wanted to do. And I think I was greatly influenced by one of my previous bosses, a gentleman called Professor McMahon, who was professor of surgery in Leeds for many years, and he was a pioneer in laparoscopic upper GI surgery. He was one of the first people in the country to do laparoscopic cholecystectomy and was definitely the first person to um, set up training courses for that. He was also one of the first people to do laparoscopic bariatric surgery in this country as well. And I had the great fortune of not only being a senior house officer, but a research fellow for many years. And I think that time working for him is what really cemented my interest in upper GI surgery and why I pursued that field. I think there are several things I find very rewarding. On the one hand, in my emergency practice, when you're dealing with a life-threatening situation and you're able to, yeah, you're able to make a quick assessment and institute life-saving treatment, and it's successful. This is obviously very satisfying. But in my elective practice, I think what gives me the most satisfaction is taking on a very difficult clinical problem, especially um, and benign upper GI, a complex benign upper GI is full of these because we deal with a lot of functional disease. It's not as um, straightforward facts, figures, and numbers. It's you have to really take a very careful history and listen to the patients to try and find out exactly what the problems are and actually develop a kind of individualized solution for it. And I think what I find rewarding is when patients come to me and, at the end of the consultation and say, and are happy that I've taken the time to listen to them. And many often say that I'm the first person who's actually in their healthcare journey to have actually taken that time to sit down and listen to them. And I also get a lot of satisfaction developing that treatment plan, which sometimes involves very complex surgery. And when that surgery has good effects and impacts on the patient's quality of life.